Joining us now is Portea Medical and the lady behind it, Miss Meena Ganesh. Thank you so much for joining us here on ET Now. Ms. Ganesh, with the second wave, I know you barely have a few minutes in a day, so we really appreciate you taking the time out for this interview. Can I begin by asking you that if we were to talk about one of the epicenters, which is the Delhi National Capital Region, are you still able to offer healthcare services at home for COVID-19 patients? Because, one keeps hearing how there are no staff available, there are no nurses available.
Yes, Nayantara, it is really heartbreaking to see the colossal challenge that the country is going through. And of course, from a home care perspective, we are trying our best to rise up to the occasion. Um, the things that we are providing, and of course, it depends upon availability of capacity, are making sure that patients who are sick and need oxygen therapy at home are provided oxygen concentrators. They are provided nurses who can monitor them round the clock and make sure that they can be kept away from a hospital to the extent that that is possible. Now, this is something which is what we are trying to do, and we are at times successful, sometimes fail, because the number of oxygen concentrators in the market has shrunk very, very drastically. So we are, as and when we get the oxygen concentrators, we provide the service. Nurses, we are still able to provide nurses and nursing attendants. A lot of elderlies who are COVID stricken need people to ensure that they're able to do the day-to-day activities effectively around in their household, and that requires oxygen, that requires nursing attendant, so we provide that as well. And we are trying our best. We're also trying to arrange these oxygen concentrators through a couple of other um, uh, there are some foundations which are helping us. One is the KVN Foundation, which did Feed My City last year, is now providing us with oxygen concentrators. ACT Grants is providing us with oxygen concentrators, so we can serve not just those that can pay, but also those that cannot pay. And that the tragedy in those families is even higher, because probably these are the breadwinners who are sick, and they really need to make sure that these breadwinners are able to are taken care of properly. Yes, very, very
Yeah.
difficult times, working very hard to make it work as far as possible.
So, Ms. Ganesh, there's a piece that has been written by Dr. Devi Shetty today, and he's raising the next alarm, saying, okay, oxygen concentrators, the supply of oxygen will be taken care of for the next couple of days, but the serious problem is going to be the shortage of healthcare workers, is going to be the shortage of nurses. He's given one suggestion, which is that maybe the government could look at, all of those who are in the final year to be brought on ground to use them as as healthcare workers, as frontline workers to fight coronavirus. Do you think that can make a massive impact the way Dr. Shetty is talking about, and is that the way to go?
Yes, I did listen to his video and also his post, and he's absolutely right. We are staring at, and the reason why I say that, I don't think we have reached the peak at all, and we are far from the peak. And as things become worse, in the second week and the third week of May, I think that things may become worse, and we do need to have enough of beds, enough of people, enough of homes, enough of isolation centers. All of these have to be put together, but behind all of that, we need manpower. So both getting more and more of nurses who are last year students to get out to be available. A lot of the work that needs to be done does not require very high level of skill. It requires continuous monitoring, and people can be trained to quickly get up and do that. So that is one. Second, if we can get more nursing attendants, they can support a lot of elderly patients who when they're sick, need somebody to round the clock monitor them. They don't need to be medically very superior, but at least they can manage them, keep them out of hospitals. Then there are a lot of these isolation centers that are coming up in hotels, etc. Those also need monitoring. So uh, combination of more nursing attendants to be quickly turned out, nurses, as well as doctors who might be in their final year. We will need all of them to jump in and manage this crisis. It's of epic scales now.
Ms. Ganesh, when Portea is probably working at overcapacity, the way you're talking, I'm asking this question also on behalf of all the viewers who are tuning in. Uh, how do you decide who will get the medical aid at home or not? Is it literally a case of fastest fingers first, uh, time, luck? How does it work?
See, first and foremost, we need to see the acuity of the patient. The one who is sickest needs to be the one that needs to be attended to at the earliest. So that always is something which is on our top of my mind. How do we make sure that people who are really suffering are the ones that are provided with the support? How do we make sure that the poor people are not neglected, and that's why we're getting in foundations to help. Just because they're poor, it doesn't mean that they suffer any less. We need to make sure that they are taken care of. So it is, I mean, at this point, as hospitals are, we are trying to do our best, and we struggle to get hospital beds for our own employees, as I'm sure is the case across the country, and there people are sick, just cannot get them into the hospital. So what best can we do at home is how we are trying to manage this crisis currently.
No, what I was trying to also understand is, and you've also been one of the pioneers of health tech in India. You're one of the first movers in that sense. Does your app algorithm is smart enough to know, okay, this patient is more severe and therefore this patient needs more care than another patient who is not as severe, and we can, attend to that patient later?
Yes.
And I'm talking about when you agree to
Yeah.
a home care service.
Yeah, that's a very good point you make. There are a large number of patients whom we monitor remotely. So what we do is that they capture all the vitals that we ask them to capture. That data is captured by us. It's available to us on our system, and our system then prompts and tells us who are the people who are looking that they're going down a sicker route. What intervention do we need to do? Do we need to move them to a hospital? Do we need to just get them some medicine so that they can stabilize at home? Do they need oxygen? So absolutely, a combination of technology and remote monitoring is something that helps us in making the scarce resources go of a longer way. Yes.
While you're with us, can you give us a little sense also where you are when it comes to ICU beds right now? Because India's gasping for oxygen. Oxygen should hopefully be taken care of in the days to come. For everyone's looking at ICU beds as a lifesaver. It's not the beds which are lifesavers, right? It's the healthcare workers, it's the knowledge, it's the having all the COVID resources, whether it's medication and all of that to fight it. Where are you when it comes to home ICU setups, when it comes to home CT scans, home blood reports for COVID-19?
So there are certain things which can be done at home. And when a lot of people, when they say they want a home ICU, they actually are referring to just oxygenation at home. And that's the first and foremost thing that I would advise people to. If there is a drop in oxygen, let's get an oxygen concentrator and stabilize the patient. And along with the other medication, they can be stable for most part. Now, if they are completely unstable, and for instance, their oxygen is dropping continuously, and they need to, things are going bad very fast, and they have to go into a hospital. That is not the time for home care. It is not that you can set up an ICU at home with a ventilator, with an intensivist. There aren't enough resources to go around to go into that level of acute care at home currently. So they will be needed to shift to a hospital. So the ICU beds in hospitals are important. But a lot of the load can be kept at home if people stop panicking and understand that what is the level to which care can indeed be provided at home. So that, I think, is an important message if it can go through that. So long as your oxygen levels are stable, with oxygen concentrator also, if they're stable, that's fine. You really don't need to rush to a hospital. But if it starts to go down quickly, then there is no other choice but to move to a hospital.
Absolutely, and that's the big message which is coming in from everybody, whether it is Randeep Guleria of AIMS, Dr. Naresh Trehan of Vedanta, that don't panic, leave the beds for the very severe patients. Meena Ganesh, before I let you go, I also wanted to get you on the show because the way India has been progressing, nuclear families have, of course, become predominant in urban centers. How do you address that situation. When you've got senior citizens, super senior citizens who are living alone, they don't have care. It's something that you also went through personally and why you started Portea. So I'm sure you're addressing that part. But if you could inform our viewers how you keep the primary caregivers informed about the patient's conditions.
Oh, very good point, Nayantara. And across all the large metros and even some of the smaller towns where there's been a lot of migration, elderlies are staying alone and they need continuous support. More than anything is first and foremost, they need to know that there's a place that they can call and they can get help. That's the first support that they need. Then secondly, many of them need round the clock help to make sure that they're being monitored properly, and more so during the COVID time. Even if it's not a COVID patient, that patient needs help medically. They need help for other support services. They need help today because they're not permitted to go out into the cities, into the markets and so on, for their own safety. Of course, they should not be going out. So the support that an elder needs is much more significant. It's not just during COVID times, but also other times, and not just for COVID, but for other requirements as well. They need continuous support, and that's where Portea has been a pioneer in elder care programs and making sure that we provide a sort of safety net for elders. Say that don't worry, we are here for you. Call us, and we will be there to support you on multiple fronts. That is something which has absolutely become the center stage now in these very testing and trying times.
Meena Ganesh, let me ask you in a very pointed manner. If somebody were to call you from Delhi, Noida, Gurgaon, Mumbai, Bengaluru, and say, I need nurses at home for a COVID patient, do you have any that you can still provide, or you're completely at overcapacity?
So in Delhi, for instance, I do not have any oxygen concentrators, but I can provide nurses still. In some of the other cities, I do have some oxygen, some nurses, so I can provide a combination of both. I was saying that is the situation as on today.
Please go ahead.
Inventories are expected. A lot of oxygen concentrators are being imported by various people, including us, and we are expecting to get those OCs during the course of this week. And by Monday, we expect that situation should be better. The only concern is that we're hearing some rumors about imports from China getting stuck, and I do hope that the government will take appropriate action to make sure that that is not the case. Products do manage to come here. We need these desperately. We need the government to support us to make sure that these equipment are made available here, life-saving equipment.
Okay, Monday is still also 6 days away, and especially when we're talking about the peak only being reached by 15th of May. Can Portea do anything at all to augment its capacity besides oxygen concentrators, other equipment, the nursing staff, healthcare workers? Is it possible?
All those, absolutely. All those we are constantly working to increase our capacity, to train people, to make to use our capacity more sensibly, do a lot more of remote monitoring so that one nurse can support 10 patients rather than one nurse supporting one patient. So from our side, we are using a combination of adding more healthcare workers, adding a layer of monitoring, adding a layer of medical management so that we can support more and more patients.
How many healthcare workers have you deployed across India for coronavirus?
Sorry, Nayantara, before that, I have one request because I am on air and I can use this platform. Those who are sitting on oxygen concentrators and do not need it, please, for heaven's sake, return it. We have people hoarding and sitting on them. If you're not sick, give it. We'll give it to you when you're sick. But those that are sick and dying need those oxygen concentrators. Do return it. So this is I'm sorry to get emotional, but it is a serious issue of hoarding that's also happening. So, but coming back to your point about how many, we have close to 3,500 workers, employees across the country, and at least 1,500 to 2,000 of those today are working to support at home sick patients. Apart from that, remotely we are supporting around 5,000 other sick patients at any point in time.
And have patients of other diseases have had to take a back seat? Is that correct?
That is correct. Unfortunately, that is very much true. The priority is for saving lives, and COVID has taken the priority. That said, if there is acute cases of other diseases, it's not that we are turning them away, we are supporting them as well.
With that, Ms. Ganesh, I know you have a lot to get back to. Thank you so much for talking to us here on ET Now. We really appreciate it.
Thank you, Nayantara. Take care.